Today we're going to talk about joints. So a joint, an articulation, or an arthrosis is defined as the point of contact between neighboring bones, between bones and cartilage, or between bones and teeth. An example of this, we could see an image here where the humerus articulates with the glenoid cavity, and this is considered the shoulder joint. Joint structure will define its function. So if we look at the term arthrology, that means the study of joints. The suffix ology refers to the study of. Kinesiology is the study of body movements. So we classify joints in two ways, either by function and how they move, or by structure, or the anatomical features of the joint itself. So first look at function, the degree of movement. The term synarthrosis means an immovable joint. We see this in fibrous and cartilaginous joints. Amphiarthrosis, actually it can be more cartilaginous, slightly movable joint. Diarthrosis is freely movable joints, such as in the synovial joints. So let's look at the structural classification. There's three types. A fibrous joint means that the mass that connects the two bones together is made up of dense, irregular connective tissue. There is no synovial cavity in a fibrous connective tissue. A cartilaginous joint has cartilage that connects the two bones together. It's usually hyaline or fibrocartilage. There's no synovial cavity in this one. A synovial joint is what we think of usually when we think of our joints in the body. It's the most common ones. So these have an articulating capsule which provides a lubrication. The connection is dense, irregular connective tissue, and these do have a synovial cavity. Generally, the greater the mobility of the joint correlates with the greater instability and possible injury of the joints. An example of this could be the hip, the knee, and the shoulder joints. We studied these terms in the past, but let's review the definitions. What a ligament means is either it's dense regular or dense irregular connective tissue. It's the structures that bind one bone to another. When we think of the term sprain with a P, it's an injury to a ligament. When we think of the term strain with a T, it's an injury to a muscle. So let's look at the sprain. So this is an example of an ankle sprain. This is an inversion sprain. What could we injure? We can injure the ligaments. And what happens? It's going to, of course, be painful. It could swell. It can become bruised eventually. What do? Here's a nice mnemonic called PRICE. First of all, you want to protect the area. RET, ice rather than heat. C is for compression, like a wrist brace, an ankle brace, and E would be elevation for treatment. So let's start with the fibrous joint. So this means that the connecting bones are connected by dense, irregular connective tissue. There's three types of fibrous joints. The first one is sutures. Sutures are in between the skull bones. The second one is called syndesmosis. Syndesmosis, an example of this image here would be this little ligament in the front connecting the tibia to the fibula. It's called the anterior tibiofibular ligament. Another example of a syndesmosis is a gymphosis joint, which is our tooth socket. We'll go into this in more detail. The third type of fibrous joint is an interosseous membrane. That's this membrane that connects the tibia to the fibula. Also, a similar interosseous membrane exists in between our radius and ulna in the upper extremity. So sutures are synarthritic. We do not want the bones in between the skull to move because they're important in protecting our brain. So these interlocking bones in the skull give strength and decrease the chance of fractures. The second one would be the syndesmosis. These are amphiarthritic joints, and they permit a small amount of movement. For example, in that tibiofibular joint, in order to move your foot internally and externally, you need to have a little movement at this syndesmosis region. The third one was the interosseous membrane. This is amphiarthrosis. Also similar to moving your foot, as we move the foot or the wrist, this region has to move to a slight amount, to minimal amount. So again, here are the sutures. They have interlocking connections between the skull bones and decreases the likelihood of a fracture if you should hit your head. And these are immovable or synarthritic joints. It's different in an infant skull where we have fontanelles. And the fontanelles are amphiarthritic because we do need a slight amount of movement there. The fontanelles are movable to a slight amount, and that needs to be that way because as the brain of the infant is growing, it needs to coordinate the movement of the fontanelles. Syndesmosis, this is a fibrous joint. There's a little greater distance between the articulating surfaces, so it's also dense, irregular connective tissue. An example is this, that anterior tibiofibular ligament. So it's between the tibia and the fibula in the lower limb. And it's slightly movable or amphiarthritic. Another example of a syndesmosis is a gymphosis. So this is the tooth joint. This is the alveolar process in the mandible and the maxillary bone on top. And this gymphosis joint is synarthrosis. So meaning it's not going to move. We do not want the teeth in our mouth to move, especially if we're chewing something that's a little tougher. The third type of fibrous joint is the interosseous membrane. So this is a band of dense, irregular connective tissue binding neighboring long bones. So in this case, we have the radius and the ulna, and also between the tibia and the fibula. So this is that interosseous membrane, and we want some movement in this membrane. So it's amphiarthrosis when we're twisting our hand, putting our palm superior and inferior, or we're twisting our ankle internally or externally. There should be movement there. So here's an overview of the fibrous joints. They have no synovial capsule, and they're bound together by fibrous connective tissue. Sutures are synarthrosis. An example would be a coronal suture. Syndesmosis are amphiarthrosis, slightly movable. And remember, that was that distal tibiofibular joint ligament. The third one were the interosseous membranes. Again, we see this between the tibia and fibula and between the radius and ulna, and they're also amphiarthrosis. The next joint classification is called a cartilaginous joint. So these joints are connected with cartilage, either hyaline cartilage or fibrocartilage. So there's two kinds. There's a synchondrosis. So don't confuse this with the syndesmosis of a fibrous joint, and you're going to differentiate it because this says synchondrosis. Okay, so versus a syndesmosis, which is a fibrous. So a synchondrosis is a synarthrosis immovable joint. Some examples of this would be the costal cartilages and also the epiphyseal plate. Remember, we learned that the epiphyseal plate in a long bone, I'm just going to pretend this is a, let's say it's a femur. This is the head. This is the epiphysis, and this is the metaphysis. So remember, the epiphyseal plate, when you see plate for play, that is that the bone is still growing in length. So this layer of hyaline cartilage is a synchondrosis. So the epiphyseal plate is categorized as a cartilaginous joint. It's synchondrosis and it's synarthritic. So even though this is allowing for the growth in length, it's immovable. So there is no movement, for example, the shifting of the epiphysis over the metaphysis. It should not move. A second type of cartilaginous joint is symphysis. So symphysis are amphiarthritic joints. They're amphiarthrosis, meaning slightly movable. Their purpose is for shock absorption. And we'll look at what these two look like. So a synchondrosis joint is considered an epiphyseal plate that we talked about in the past. It's the region on long bones where they're growing in length. So they're synarthritic. They're connected by hyaline cartilage. This is hyaline cartilage. And they're the epiphyseal plates in long bones. The symphysis, they're amphiarthrosis, so they are a flat disc of fibrocartilage. So it's a different cartilage. And this always is going to occur in the middle of the body. So an example of this is the pubic symphysis. It's a little disc that exists, in this case, between our pelvic bones. So this area is amphiarthrosis, so it's slightly movable. Another example of this would be at the intervertebral discs, and I'll show you what that looks like. So again, here's an overview of cartilaginous joints that are synchondrosis. So they're made up of hyaline cartilage, and they're synarthrosis, meaning they're immovable. Where do we see this? The epiphyseal plates, and also the costal cartilage joints, costochondral joints. So these are the joints where the ribs connect to the sternum. The second type is called the symphysis. So we have to note that symphysis always occur in the center of the body. And the first one here is called the pubic symphysis, which is amphiarthritic. It's a shock absorber. There's some movement here, especially in a woman who's carrying the fetus in this region. Upon delivery, this has to soften and spread out and widen as especially women deliver the baby. The next one is at the intervertebral discs. So if we're looking at this image, which is the low back or the lumbar spine, these are called vertebra, okay? And these are called like between the vertebral discs. They're made up of fibrocartilage and amphiarthrosis. The purpose of these intervertebral discs is allowing the spine to be flexible. It allows us to move, flex, extend, laterally flex, rotate. It's a shock absorber. So there's some movement there, and it's made up of fibrocartilaginous material. The last category are called synovial joints. So synovial joints are what we think of when we think of a joint generally. They're freely movable or diarthrosis. They have a synovial cavity surrounded by a connective tissue capsule that attaches to bones. So let's look at the features of the synovial joints. They have articular cartilage. Remember, the cartilage at the end of bones, we had like a bone here and a bone here, right? At a joint or an articulation. And at the end of the bone, remember, there was a little pad called articular cartilage. And this provides a smooth surface where one bone meets another bone. Around this bone is what we call an articular joint capsule. So there's a little capsule here, okay? And the capsule is made up of two layers. The outer capsule is made up of dense, irregular connective tissue, and that capsule is going to connect to the periosteum of the bone itself. Remember, we learned from bones, the outer layer of the bone is called the periosteum, and that's made up of also dense, irregular connective tissue, which makes the connection of the capsule to the periosteum very strong in pulling strength or tensile strength and flexibility. The inner layer of this joint capsule has a synovial membrane, and what that does is secretes synovial fluid. The inside is made up of areolar loose connective tissue. And within the joints, there's also articular fat pads that add cushioning to the joints. So synovial membranes line the cavities of these freely movable joints, and they secrete synovial fluid. So this fluid is made up of hyaluronic acid, interstitial fluid, which is filtered from blood. And some of the functions of this synovial membrane are joint lubrication, also act as shock absorber. So remember, we were taught that that articular cartilage at the end of the bones is avascular, and it's made up of hyaline cartilage. And the interesting fact, an important fact to understand about that articular cartilage, does not have a perichondrium. So what that means is it doesn't have a method of giving the tissue nutrition. So the way it's going to get its nutrition is through the synovial fluid. It's going to supply oxygen and nutrients to the chondrocytes, or the mature bone cells within the articular cartilage. It also contains macrophages to remove microbes and dervis from the joint cavity. So let's look at this example of a phalange or a finger. Here is one bone and then the other bone, and this is probably an interphalangeal joint. The outside of the bone has the periosteum. Here's the joint capsule. It's made up of an outer layer, fibrous membrane, that connects via the dense, irregular connective tissue of the fibrous membrane to the dense, irregular connected tissue of the periosteum. So it makes this connection very strong, very flexible, tensile strength, meaning you could pull on it and it's not going to tear that easily. The inner layer, you could see in red, has a synovial membrane which secretes synovial fluid. And as we talked about, this fluid is going to provide nutrition to this articular cartilage at the ends of bone. So it's going to provide oxygen, nutrients, has phagocytic activity, and also lubrication, shock absorption around the joint. So when we talk about ligaments, ligaments can be either intracapsular ligaments or extracapsular ligaments. So let's look at an up-close image of the knee joint. So when we're talking about the knee joint, you could see the joint capsule out here, okay? And then the inner synovial membrane, which secretes the synovial fluid inside that joint capsule. We've talked about bursas. So bursas are sacs of synovial fluid, and they're in very movable joints such as our knees and our shoulders, and they help decrease the friction around the moving tendons over the bones. The articular disc in the knee joint, they are the meniscus. They're fibrocartilaginous discs that assist in the movement, shock absorption that occur in the knee joint. We also have tendon sheaths. So tendon sheaths are cylinders of synovial fluid that wrap around certain tendons. An example would be around the biceps brachii in the shoulder. And we talked about the fat pad. You could see the fat pad around the patella. We've got an infrapatellar and suprapatellar. We named the fat pads and the bursas based on the location, in this case around the patella. So this would be the suprapatellar bursa, and this one would be the infrapatellar bursa. There is a intracapsular ligament and extracapsular. So that means there's ligaments outside the capsule, which it's true, and there's also ligaments inside the capsule. So for example, in the knee joint, the intracapsular ligaments would be the anterior and posterior cruciates that are inside the capsule, just like there's extracapsular ligaments, which could include the lateral collateral and medial collateral ligaments in the knee. So when we're looking at the classification of synovial joints, there's a structural classification and a functional classification. So let's divide these and look at these in two ways. So we're looking at the movement of the joints or the structural classification. Gliding means a flat bone that just glides over each other. An angular movement, for example, includes flexion, extension. Flexion will decrease the angle of the joint. Extension will increase the angle of the joint. Lateral flexion would be either, here's the person, this would be a right lateral flexion. Let's see, here's his head. So you get some, here's his feet. So it's referring to the mid-back or the thoracic. This would be a left lateral flexion. Hyperextension is continuing beyond normal anatomical position. Abduction and adduction. So when we're thinking of abduction, AB, this is away from the midline, where adduction is adding to the midline. Circumduction is a circular movement. Rotation either could be medial or lateral rotation. So let's look at the gliding movement of synovial joints. It's just like one bone glides over each other. An example here would be the carpal joints. Also, we could see this in the articulating processes of the vertebra. So flexion means we're decreasing the angle of the joint. So for example, neck flexion, we're coming this way, we're decreasing that angle of the joint, versus neck extension, we're increasing the angle of the joint. Then there's hyperextension, going to normal range and then beyond that. The shoulder flexion, we're decreasing that angle of the joint. Shoulder extension, increasing that angle, and then hyperextension is going beyond that normal. Elbow flexion, here's that angle, decreasing it. Elbow extension. And in the elbow, we can't hyperextend the elbow primarily because we have an olecranon process that limits that hyperextension. Wrist flexion, or you're bringing that up to you, decreasing that ankle of the joint. Wrist extension, going to extend, and then there's wrist hyperextension. Hip, same thing, flexion is coming up, decreasing the angle, hip extension, and then you could go beyond to hyperextension. Knee, flexion, here's the angle of the joint, decreasing it, knee extension. And again, we have the patella here, which would limit the joint movement. When we're talking about lateral flexion, it's regarding the intervertebral joints, in this case, the thoracic spine. So we would call this right lateral flexion, and this one would be left lateral flexion, and it's referring to the model side, not your side. So we're thinking of abduction. So just think of AB like an abductor, like someone who's abducting your pet. It's taking it away from the midline. And adducting is adding to the center, okay? Same thing, abduction. And when we're talking about, for example, in the wrist, we always go to anatomical position. Remember, anatomical position, you're standing in this manner, your feet are separated. In this case, the palms should be facing anterior, okay? So in that case, if we're moving this way, we're moving towards the center of the body. And if we're moving, this is adduction. So adduction is moving towards the center of the body. Abduction is moving away from the center of the body. Same thing with the hip. Abduction away from the center of the body. Adduction towards the middle of the body. With opening and closing our fingers, separating is abduction, and bringing them together is adduction at the metacarpal phalangeal joints. So abduction is the movement away from the longitudinal axis of the body. AB is away from. Adduction is movement towards the longitudinal axis of the body. So adduction coming to the middle, abduction is separating. I remember it is adding to the body, AD, or AB, like an abductor taking something away. Angular movement, circumduction, is just moving these very movable ball and socket joints, like this is in the shoulder joint. You could circumduct your hip joint. Rotation, this movement, it's kind of like the no joint. This is actually between C1, the cervical spine, the first cervical vertebra, and the second cervical vertebra, gives us movement at that, we call it atlantoaxial joint. C1 is the axis and atlas. Atlas and axis. Atlas is 1 and axis is 2, and that would be the no joint or a pivot joint along the atlantoaxial joint. It's a rotation. At the shoulder, moving away in the center is lateral rotation. You'll also see lateral rotation as external rotation in certain books. So moving it away, and then medial rotation towards the center is also considered internal rotation. Okay, so you see this at the shoulder and at the hip joint. Medial moving in, lateral moving out. Okay. So let's talk about special movements at synovial joints. These are referring to the jaw. Okay. Inversion and eversion and dorsiflexion and plantar flexion are referring to the, so this is called the TMJ joint at the jaw, temporomandibular, and this is at the ankle, supination and pronation, and the opposition is related to the hand or wrist. So let's look at what these look like. So along the temporomandibular joint, elevation and depression. Elevation is bringing your jaw up. Depression is bringing your jaw down. Protraction, bringing your jaw out. Retraction, bringing it in. Related to the tarsal joints, inversion. So inversion, I like to remember it, is the fifth phalange or the pinky toe is moving in. That's inversion. Where eversion, that little pinky toe is going out. Okay. When we look at the ankle joint, we call the top of the foot the dorsum of the foot. So dorsiflexion is like we're walking on your heel, okay, or along the calcaneus. Where plantar flexion, so this is the plantar surface of the foot, you are walking on your toe, plantar flexion. Another one is along the wrist joint. We have supination, which is your palm facing up, or like asking for soup, where pronation, your palm is down. This is up and this is down, like bouncing a ball. And opposition is where you connect your thumb to the fourth phalange or fourth finger. No, I'm sorry, second. So this is considered 1, this is considered 2 in the hand, and then this is 3, 4, 5. That's how we number our fingers in the hand. So inversion, okay, the little pinky toe is going in. Eversion, that fifth toe or pinky is going out. Eversion. And that's at the intertarsal joints or the ankle joints. Dorsiflexion, this is the dorsum of the foot. So we're bringing it up, or it's walking on your heels. And this is the plantar surface of our feet. Plantar flexion at the ankle joint is walking on your toes. Supination and pronation. So supination, the palm is anterior, and pronation, the palm is posterior. Opposition, when we're looking at the fingers, it's the first and fifth digit that connect. I'm sorry, I think in the past I said this wrong. So its opposition is the first and the fifth. The carpal, metacarpal joint is opposition. All right, so let's talk about the overall movement we discussed, and also the all the movements that occur in the synovial joints. I've posted a video of these additional the variations in shape that govern the range and type of movements possible. The types of synovial joints. I'd recommend you view this after you've viewed this video. So when we're talking about axis of rotation, we describe it in 3 ways. The first one you'll see is called the monoaxial, That means the movement is only in one plane. So usually, like as in a hinge joint, which is our elbow joint, we could only flex and extend it, so that's movement in one plane or monoaxial. Biaxial is movement in two planes. So for example, we could flex and extend the joint and also abduct, bringing it away from the midline, and adduction. We see this along the wrist joint at the radiocarpal joints. And we'll learn that this type of joint is a condyloid or a saddle joint. The next one is a triaxial. So this is where there's three planes of movement. These joints are very movable, but you could flex, extend, abduct, adduct, often rotate and circumduct. These are the most mobile joints. They're considered ball and socket, which we see these at the shoulder and hip. The fourth one is a non-axial joint, where it's only a gliding joint, such as at our either intercarpal or tarsal joints. So there's little or no movement in those joints. So we'll divide this group up and let's look at each of these joints in more detail. So the types of joints we're going to talk about are the move of the description of the joint and the type of axis it moves on. So let's start with this first group, the planar joints. So we talked about how planar joints are biaxial in the sense that they're going to allow back and forth and side to side movements. So there's two movements. Where do we see these? Either between our wrist bones or intercarpal, or between our tarsal bones in the foot. The next one is called a hinge joint. So just like the term hinge means, like a hinge on a door, they are monoaxial. So they're only going to move in one direction, flexion and extension. The knee joint is an example of this, and it is called a hinge joint, kind of like a door hinge. So it's only going to like flex and extend. The pivot joint is also monoaxial. It's only moving in rotation. We see this between the radius and ulna of our extremity, which allows us to supinate and pronate. Also will occur between C1 and C2, called the atlantoaxial joint, which is a monoaxial joint and is only going to rotate, and that's called the pivot joint. The next one is a condyloid joint. A common one that's a condyloid joint is between the radius and the carpal, specifically the scaphoid, lunate, and triquetrum. And this is going to be a biaxial. So think of your wrist joint. You're going to be able to flex it and extend it, one movement. You're also going to be able to adduct it and abduct it. Saddle joint. So saddle sounds like what we think of a saddle. And a common one here would be the carpometacarpal joint between the trapezium, which is a carpal joint, and the metacarpal joint of the thumb. And this is a triaxial joint. So look at your thumb at that metacarpal phalangeal joint, or the knuckle. You're going to be able to flex it, extend it, abduct it, adduct it, and rotate it. Then is the ball and socket joint. So this is the most movable joint in the body. We've got two regions that are ball and socket, which is the shoulder and the hips, and they're triaxial. So we can flex, extend, abduct, adduct, and circumduct the shoulder joint. Okay, we are done with our joints for the day.